Angela Wadman. They're with Melanie Massey Physical Therapy, and I'm gonna just go ahead and let them take over.
Okay. You want to pass it out for me? I'm Melanie. Sabrina had called me a while back and asked me to talk about kind of what we do at our clinic with regards to urinary incontinence. We do fecal incontinence. And right now, I mean, because of the nature of this group, I'm going to be talking how it relates to post-prostatectomy patients and what we do. And the way I learned things tonight, when I was kind of getting all my pieces of paper together, I'm not one of those real organized people, so I just kind of had to pull all these different things that I give my patients depending on what day they're there and what I need to talk to them about. We have files of information on how diet affects your bladder, how your pelvic muscles affect constipation. We have just tons of handouts, and I just picked a few that I thought were most interesting and that would be interesting to y'all. Tried to organize them and drew them for you. Drew them on posters so that, you know, I didn't get a whole lot of computer knowledge in school, and I'm just kind of refusing to go that direction, so I just draw it on a poster board. Would you mind holding it for me? So what I drew was basically the prostate gland. The urethra runs through the middle of the prostate gland. This is your bladder. This is your penis. You have two sphincters that would normally close off to keep the urine from dribbling, saturating in some cases. The prostate gland, as you were having, any sort of prostatitis or cancer, anything that was causing this gland to grow, it was putting pressure on your urethra, helping your urethra stay closed. In some cases, too closed. In some cases, that's why you knew you had a problem, is you couldn't get a full stream going, or maybe you could pee a little bit and then stop and then pee a little bit because this was starting to narrow. Once your prostate's removed, you see there's little muscles on the inside there also on that wall. Once this is removed, now you don't have that support anymore. And for a lot of men, after a while, this prostate became like their backup plan for keeping the urine in the bladder. Once it's gone, now this is open again, and you better know how to use these muscles to hold it closed. And if you don't know how to use these muscles, that's what I do. After having been a physical therapist now for almost 18 years, I was amazed when I started doing some internal work, pelvic floor muscles, that I'd never done it before, because, I mean, we do the hand, we do the muscles here, 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 everywhere. And it's kind of like, we're not going to go there. But it's muscles, and that's what our game is. That's what physical therapists do, is we teach people about their bodies, how to use muscles, how to stretch them if need be. And so it just became a natural part of what I thought needed to happen in our clinic. Since then, Angela's also gone and learned a lot about this also. So there's two of us in our clinic doing it. The prostate gland produces seminal fluid to carry the sperm. Its muscular walls actually contract to help it ejaculate. That's what basically the gland is for. And then there's fibrous tissue to form an outer shell that protects the pulpous inner core of the prostate. The bladder has two functions. It is to accumulate urine, and the other one is to contract and push out urine. Okay? So there's that picture. What's also interesting when we were talking about muscles, this is actually a female pelvis. I just like the side view, but you know, men have the same spinal column. This is your back. This is your buttock. These are your lower lumbar vertebrae, and your sacrum, and your tiny little tailbone right down here at the top of your crack. You have a rectum, and instead of having your urethral opening here, it would come to the penis in the front. But the important thing here is that from your tailbone to your pubic bone in the front is this sling of musculature, and that's what we'll mostly be talking about tonight. We call it the hammock, and a lot of times I'm talking to the men because I'll say, all right, do a Kegel for me, and they'll squeeze, and I'll actually see my shoulders. I'll say, no, that's not your penis. That's not it. Okay, so if I see that you're doing it wrong.
Wrong end.
Right, and they'll say, well, how do I do it? And that's just it. A lot of times you're discharged from after post-surgery and said, now you need to go practice your Kegels, and you have no idea what that is because you've been relying on that big gland and the muscles around the gland to help you keep things closed, and now everything's just free flowing and you don't really know how to do a Kegel. So that's where we come in.
By the way, you know, a lot of us don't have that gland anymore.
Oh, none of you do, right? Is this a post-prostatectomy group or not entirely? I am aware of that. Yeah, that's why I'm saying you
Yeah.
don't have that gland anymore, so you have to learn to use these muscles. Right. You got any other questions? I'll make sure I was clear on that. Yeah, I understand that. Okay. So, what are the pelvic floor muscles? These are muscles which stretch from the pubic bone to the tailbone. We're going to do a little exercise in a minute, try to find it. They support the bladder, the urethra, and any internal organs. A lot of women have issues with leakage because this hammock underneath, you know, they've had children, so they've had babies inside which have stretched. Then they really stretched it as they bore children. We're always vertical, so all of our organs are always bearing down on this hammock. And if you've had any surgery, then you've also had some intrusion to the muscles and sometimes the nerves that would fire those muscles for you. One of the ways you can know, nerve damage. One of the ways you can know if you're able to contract your muscle appropriately and do a Kegel the right way is whether it's called a urine stop test. If you're standing and you pee, can you stop it? Can you slow it down a little bit and then have a full stream, and then slow it down a little bit and have a full stream? That's one of the questions I'll ask during evaluation is, are you able to do that? If you're not able to do that, you do not have control of that muscle. Okay. Pelvic floor muscles can be too weak. They can be stretched out, like in the case of the women I was talking about. It may be that for a long time you depended on the gland that is no longer there, and so you've never really had to use your pelvic floor muscles, and so they're weak, just like my abdominals are, because I don't use them too much. Or they can also be too tight. It can be that you for so long tried to, leaked, tried to hold everything in that the muscles got so short and tight that they're non-functional. That doesn't make sense sometimes, but if I explain it to you like this, you see somebody who's had a stroke and they're maybe kind of walking, like this, and have you ever seen somebody with a stroke that has the arm kind of up? If I ask that, well, obviously the bicep is the muscle that bends your elbow. So obviously if that stroke patient has their muscle this short, then if I put on some sort of electrode to see if this muscle was firing, oh yeah, it's firing a lot, too much. So much that if I asked them to pick something up off that table, they couldn't, because they couldn't lengthen it to pick it up, right? So it is firing, it's too tight. I'm gonna give you another example. Sometimes my examples are worse, I should just stay with the plan, but anyway, if I told you I needed you to pick up, help me pick up this table, and I'm only gonna allow you to use your bicep from 90 degrees and shorter. So you're gonna have to pick it up like this. It's gonna be kind of hard because you can't generate a lot of power in a shortened muscle range. If I told you now, I need you to pick this table up and move it over there, and you're gonna have to do it by yourself, you could probably go, and I'm gonna allow you full range of motion of your muscle. You could pick that whole table up by yourself probably and carry it somewhere. And you see how, just because I can lengthen my muscle. So just like you don't want your pelvic floor muscles to be weak, allowing the urine to escape, you also can't have them so tight that they don't know how to effectively relax and contract. If you'll notice, passing through here is your bladder and your urethra, but also passing through is your rectum. So a lot of times if men or women have kept their pelvic floor muscles too tight for too long, they'll find themselves very constipated because and then you'll have like a rectocele where you can actually strain so much trying to pass your bowels that you'll actually turn your rectum inside out. And that happens vaginally too sometimes for women. So it's very important to have normal muscle tone in your pelvic girdle. It was funny, I was seeing a woman the other day and I was talking about an earlier patient I'd had, it was male, and she said, but men don't have pelvic floor muscles. I said, yes they do. They don't have some of the other things you're talking about, but they have pelvic floor muscles because they have a pelvis. And your pelvis is basically a ring of bones that start at your pubis and come around to your tailbone. And that makes up your pelvic circle. So any muscles in between, that's called your hammock. And one of the things I thought we might do is to kind of put your hands on your lower abdomen. Everybody do it. Everybody do it. And try and put your other leg down. I think that'll help you. There you go. Now try and pull your tailbone toward your hand. and that's how sometimes I'll teach people to do an appropriate Kegel, is to try and lift up and toward their hand, instead of squeezing your buttocks. Make sure you're not squeezing your buttocks, because that's usually what people do. Squeeze their butt muscle, bring their belly in, but it should be an internal squeeze, trying to bring your tailbone toward the hand in the front, which is doing this. It's bringing this towards this. That's a bone, that's a bone, okay? A lot of times I'll give once we find the muscle in therapy, and there's other ways we find it, I usually give patients a home program where we'll do 3 sets of quick flicks, or when you fire that muscle very fast. So you can try it right now, just doing quick flicks of Kegels very fast. And then we do hold, because you also have to have endurance. And I'll talk more in a little bit about why it's important to have each kind of contraction. One other thing we do to help people find their muscles, we have these little probes. I'll pass that around. We have these little probes. They're rectal probes for men. We have vaginal probes for women. It's the way that we can access your muscles and hook it up to an electric stimulator. Ooh, Lord. Hook it up to this electric stimulator. And when a man's telling me, I just cannot find that, I'm still leaking, I cannot find the muscle, I do not know how to isolate the muscle, I can put this in. You did electric stimulation at Shreveport? You can find the muscle and fire it. I can fire it for you and say, now do you feel that? And if you feel that, then that's the muscle that we need to be firing. It's exactly what I would do for this stroke patient who can't open their hand. I would put these leads, surface leads, on their arm, turn up the same exact instrument, turn it up until their hand starts to come open. So if I ask them, open your hand, I can't. I don't know how to find that muscle. I'm going to open it for you. Now, you got it? Come with me. Every time we fire it, come with me. Same thing with the internal probe. I don't know how to find a Kegel. All right, I'm going to show you. Here it is. Do you feel it squeezing? Yeah, I feel it squeezing. Whoa, that's enough. Then we turn it down a little bit. Okay, squeeze with me. Then once you got that, now I'm going to turn it off. Now you do it by yourself.
And that helps strengthen those muscles in there. So every time you squeeze, it strengthens the muscles with it. So you're it's strengthening the
Learning
muscles
how to
when you
do it.
squeeze, yeah.
Another thing we do is I will take the same probe, leave it in, hook it up to my computer. We do biofeedback. Did you do biofeedback in Shreveport? Very
That's
neat.
what we did.
We have a little computer screen. I kind of simulated this computer screen, and the probe is inside, and I'll say, squeeze. I'm looking for how many microvolts of strength can you produce? I can do it about every 5 seconds. I may say, now squeeze, relax. Let's follow this orange line. Squeeze, relax, squeeze, relax, squeeze, relax. This person is going from almost the baseline, 0 or 1, up to about 5. So they're producing about 4 or 5 microvolts of strength. Not very strong. The good thing that they're doing is they're coming down here to the baseline. I'll explain that in just a second. This guy, the purple guy, is going from about 2 up to about 40, and then 2 up to about 40. I'm asking them to hold for a 5-second count, and so what I'm noticing is that they don't have much endurance. See how they can spike, but they don't hold it for very long. That means they can almost make it to the bathroom squeeze, but then they're probably going to lose it because they don't have the endurance to hold it until they get where they need to go. What I usually see is good spikes, and then all of a sudden we get down here and it gets weaker, like this black line. You know, it's getting weaker and weaker and weaker because fatigue is often a problem also, unless I give you a home program and we use your electric stimulation and all the other things that go into teaching you how to use those muscles effectively and strengthen them. This person, although they have really good numbers up here, if your resting tone is at 15, then that means you're that stroke patient that's keeping your muscle too tight all the time. Ideally, we go from under 2 up to 40. Under 2 up to 40 with control. So every 5 seconds, and relax. Up and relax. Contract and relax. And then I change screens. On another screen, I might have you hold. Now this time we're going to hold for 5 seconds. So up, hold, 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 and down. And a lot of times, the more that you squeeze, and I'm just going to do it like this because it's more of a circumferential squeeze on that probe, when you squeeze, it's really hard for a lot of men to then relax, especially post-prostatectomy patients is what I'm seeing. they have more trouble relaxing than they do squeezing. So when a muscle gets tight, it stays tight, a lot of times you'll have pain issues. It can be squeezing on a nerve. It can be squeezing on arteries that might cause some blood supply issues. So a lot of times I'm going to work on, first, I want you to learn to breathe. I want you to learn to relax. And we will go through a whole process. Both of my guys that started Monday, their first home program was to go sit in their recliner, breathe in and out with their belly, just deep breathing, diaphragmatic breathing. Focus on your shoulders, relax them into the recliner. Deep breath in, deep breath out. Relax your chest. Deep breath in, deep breath out. Relax your arms. And I did this with them today. I just coached them through it. Everything relaxed. When you get to the pelvic girdle, I really stop and focus on totally relaxing your buttocks. Totally relaxing. And then, once they're totally relaxed, I ask them to pay attention to that hammock, that sling, from the front to the back. Pay attention to it. One of them today had practiced it a little bit, and I said, okay, now here's what I want you to do. Here's why I asked you to do that. I want all of y'all right now to think about the arch of your right foot. See how you can kind of suddenly feel it when you weren't thinking anything about it a few seconds ago? Now think about your left pinky finger. And all of a sudden you're aware of it. So if you've never really used your pelvic floor muscles, first thing we need to do, very first day, figure out where it's at. Find it. Think about it. Relax. Because you're going to have to relax in order to use it, in order to hold your urine in. So, the two main types of contractions, like I said a while ago, are the quick flicks. I want you to squeeze, relax, squeeze, relax, squeeze, relax. And the other one is endurance. Endurance makes sense. I've got to make it to the bathroom. Quick flicks are a type of contraction that are used when somebody, a lot of times, men, because they're worried they're going to leak, go way too often, and they find themselves in the bathroom, even as frequently as every 30 minutes, and that is very bad for your bladder. It trains your bladder to send a signal to your brain about every 30 minutes or every hour saying, oh, I got to go again. We're not supposed to do that. You're supposed to be able to hold it at least 2 hours all day long, and when you do go to the bathroom, you should count 8 Mississippi. 1 Mississippi, 2 Mississippi, 3 Mississippi. You should have a nice long pee. And if you're going too often, then you're asking your bladder to shrink because you're not letting it fill up and you're not letting it expand. If it starts to shrink, then it has a lower threshold for activation. That means a little bit of urine gets in there and the threshold is so low that it goes, whoo, I gotta go to the bathroom, and it tells your brain, let's go. That's not normal. You should hold 2 cups, I think 2 cups of urine in your bladder. So it's when you use quick flicks, those quick muscles, does anybody have an issue with urge? Like I just can't make it to the bathroom. I feel like when I gotta go, I go immediately. Because if that's the problem, a way you can trick your bladder is to do quick flicks. Use your Kegels and squeeze 10 fast times and then relax. See if the urge goes away. Try to postpone going to the bathroom because again, we don't want the bladder thinking it's gotta go all the time. Sit down, relax. Did the urge pass? Go on your merry way. If not, go to the bathroom. But at least you tried. There is an actual neurological reflex that when you squeeze your pelvic floor muscles and you do that Kegel, it opens your bladder and says, don't push. When you relax your pelvic floor muscles, so if they're weak and you don't know how to squeeze them, it automatically tells your bladder, push. So you pee. So if my bladder's going, I gotta pee because it's been an hour, it's been 30 minutes and I go every 30 minutes, I gotta pee. If you'll take those pelvic floor muscles and go squeeze, 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 you open up your bladder and it'll hold more urine. That's the trick. Okay?
That doesn't work if you take Lasix. But it's a Lasix.
Well, I have to think on that one.
No, I don't.
You stand in the bathroom.
Huh?
You take Lasix, you stand in the bathroom.
There you got it.
That's something I've talked to my patients about too, is, you said staying in the bathroom, but I thought you were saying standing in the bathroom. A lot of times if people will have residual volume, they have a cystogram, and it'll show that they're not emptying their bladder all the way. Both my guys this week were like this. And I asked them to start sitting on the commode and taking their time. one of my things I was reading said, there's a reason you have rest in restroom, is you should stop, you know, we're always just in a hurry. Stop, rest, sitting down kind of makes you do that. And then taking your body weight and actually going in a clock, sir, all the way around to try and make sure that your body weight has helped push out all of the urine in your bladder. So that's a little trick. Another thing we do with our electrode is we'll have this one internal, and we'll take one of those surface electrodes and put it somewhere else, like maybe your glutes, maybe your butt muscle, maybe your thigh muscle, and we'll say, all right, with this, where's my biofeedback? Oh, it's right here. We'll say squeeze, and I'll have now I've got two things hooked up to you. So let's say this one is inside, it's in your rectum. This one is in your, is on your thigh, or on your butt. And I'll say squeeze. What I'm looking for is to make sure that that orange one doesn't jump way up there too. In women a lot of times, or in men too, I could put one, instead of being on your butt muscle, I could put it on your stomach and say, now, cough. And if this orange one goes up above the purple one, you're probably gonna pee every time you cough. All right, now, bend down and pick that shoe up for me. I just leaked. Okay, then let's look at what just happened on the screen. Yep, orange just went over purple. That meant that you put more pressure downward than you did holding up. So let's try it again. This time I want you to lift your pelvic floor, hold your Kegel, ready, breathe, exhale with the work, pick it up. Good, the purple stayed above the orange, you didn't leak. So it's a lot of muscular retraining and coordination. All right, a typical treatment program is about 4 to 8 weeks. 50% of all men who've had post-prostatectomy surgeries are incontinent. It's typical for the incontinence to be 6 weeks after surgery. For a year or more, it's about 20% of the men will still have problems with leaking outside of a year. If there's been a radical prostatectomy with radiation, you're looking at about a 12-month program because you're going to have some nerve and muscle regeneration and healing that has to take place. So you're going to do your initial 4 to 6 week program, which is fairly intense, maybe a couple of times a week, to learn all the things that we teach you, which we have a huge handout. Where's our, is this it? We have a huge handout that we'll give you on the quick flicks, how to control your urge, pelvic electric stimulation, biofeedback. We'll have to go through all of these things, diaphragmatic breathing, how diet affects your health, what normal bladder health is, et cetera, et cetera. That's about a 4 to 6 week program. After that, we'll see you maybe one time a month or maybe one time every 2 months, making sure that every time you come in, we change up your program. I have patients who are doing great. They don't leak very much, but dadgummit, every time I pick up my kid, there we go again. And so I'll have them on a home program that they're actually little tiny weights that we'll insert. And I say, and they've got a string on them, and I'll say, now hold that weight, and I want you to squeeze up, hold it in, and do 10 of these, or something like that. I want it to stay in. Now I want you to jump out and in. And they're like, I can't. Then we back down our weight. When I went to the course, you know, this was new to me. When I went to my continuing ed up in Wisconsin, room full of women, it was kind of, you knew pretty much who had had issues and who hadn't, because when we started the first little weight, a lot of the women were like, I can't even stand up. I can't even stand up. And then, you know, we were walking around going, ah! And then we progressed through the different weights. And anyway, it's pretty revealing. Fluids, just like I told you, your bladder can learn a new size. That's why you don't want to not have fluids, just because you're scared you'll pee. So you need to make sure that you're drinking plenty of fluids, because if you don't, your bladder will shrink. And there it goes again. Now it's back to where it's not going to hold very much. It sends a message to the brain, I've got to go too often. So you want your bladder to have a nice elasticity, stay full, stay big. You should have about 6 to 8 glasses of non-caffeinated fluid a day.
Like my ears.
That probably works. That probably works. Also, if you have a smaller bladder, you have less urine. The urine is more concentrated. Concentrated urine is more irritating to the bladder, and irritation to the bladder will actually cause your detrusor, which is your bladder, to start squeezing, making your pelvic floor relax, and you'll leak. And that's about all. There was one other little thing I kind of wanted to go over. You want to come be my guinea pig? Come sit right here. Sit right here, face that direction. She did this to me right before we left. I had never done this with a patient, but I thought it was really interesting. I want you to just kind of sit forward in your chair. Was it forward in your chair? Yeah. Just sit forward in your chair for a second. Relax. You see how easy it was for me to pull him back? Or are you pushing forward? Pull him back? Okay. You see how easy it was for me to push you back? Pull you back? Right now. This time I want you to hold your belly tight. What, too hard again? Something popped. You need to come see me. Now, it was a little harder. Okay, now I want you to hold your belly tight and lift your pelvic floor. Lift it like we talked about. Do a Kegel underneath. Ready? Hold. Everything got a lot harder. What do you
He's
do?
using his whole body.
You're doing your whole body. You wise up to me now. But it was really amazing to me how, okay, you can go on back, how different it was to have nothing on, to turn on my abdominals, which should be the resistor to extension, because your abdominals are flexors. So when she pulled me back, I had my stomach on. Well, I'm never gonna do a Kegel unless somebody says, okay, now do a Kegel, because I don't have leakage problems. If I did, I'd probably go around and do them all the time, then I'd have that whole stroke phenomenon of too tight. But then she said, now do a Kegel and fire your abdominals. And when I did that, it was virtually impossible to move me. So we also, when you're through with kind of the basic program, we make sure that we teach you about posture, abdominal support, how to use your posture and abdominal support to prevent any more leakage, and et cetera, how to lift, how to work, put you at your workstation, whatever you're going back, functional life. We need to get you back there without a fear of leakage. Have any questions for me? Everybody's just stunned. What you thinking?
In my case, I get up 2 or 3 times a night. Am I just drinking too much liquid in the evening?
You probably should do you have any issues during the day? No issues during the day, you're just getting up a lot at night? You should probably try and cut your fluids off around 6. That's the ideal scenario. That means you can't go out drinking.
Well, yeah, that's
Just
what I
have
was
trouble.
going to
Stay home
ask
and
you, if I'm drinking wine or beer, does that have an impact?
Yeah.
Or is it just?
Yes. Yeah, alcohol is a bladder irritant, caffeine is a bladder irritant, milk is a bladder irritant,
Milk?
citrus, any kind of acidic foods, vinegar, because I guess the caffeine in chocolate. We give our patients a list, and then we also give you alternatives. I don't know an alternative to liquor, but liquor's liquor. But we do give you alternatives for coffee, because a lot of patients are like, I can't give up coffee. So we say, well, we'll try some of these and see if they can suit you.
Just cut it back.
But yes, and you should notice that. We also have our patients fill out a diary, a bladder log, a voiding log, so that maybe you get up once a night, and then all of a sudden the weekend hits and you drank a couple of glasses of wine, you notice I had to get up twice, and then I was up again at 6. And then you start putting it together and going, oh, well, that's the deal. If I want a good night's sleep, I better not drink alcohol, or I better stop drinking before 6 or whatever, because we actually have you fill out every single thing you drank, some cases what you ate, every time you go to the bathroom, how long you went to the bathroom, 3 Mississippi, 4 Mississippi, because that works, because everybody kind of says that the same. And then we can have a good history, and we know exactly what we're dealing with, not just, I think I went yesterday, I think I went twice. I'll ask people, how many times a day do you go? That's part of my intake. And they'll say, probably about 6. So I'll say, okay, let's start here. When you get up in the morning, do you go right off the bat? Yeah. Do you go again before you leave? Yeah, because I drink coffee. Okay, so you go then. What about when you get to work? Do you have to go again? Yeah, I usually go right about an hour after I've been there. Okay, then again before lunch? Yeah. By the time we're through with it, they've gone 11, 12 times, and they had no idea that they were going that much. So,
For people that have had prostate cancer, do they develop this later on?
no, usually it's going to happen earlier. Anybody can develop it later on. Anybody can develop it later on, because in the case of women, I can speak for women for sure, they just gravity, just being erect and having all of your organs sag down on your hammock causes that to weaken and causes some urine loss. And you know men, I mean, I used to work in a nursing home, lots and lots of people in the nursing home are in diapers, men and women, and it's just from aging, atrophy of muscles. Like I said, these are muscles, just like this is a muscle and this is a muscle and this is a muscle. So I don't think it necessarily, if you've come through cancer and you've come through the prostatectomy or whatever you've had, done, and you're not having those issues, then your urine loss later, your incontinence later, it's probably gonna be related to your, it's just gonna be aging process. But it's just a shame how many people will just accept it as that, where it depends, and that's that. I have recently had a guy who came to see me and he was wearing Depends. He was from Rayville and he had just had his surgery. A Depends diaper, full diaper. And he said, I can't be like this. I just can't. I'm working and I'm always worried about it and I can't get my life, my mind won't get off of it. And I said, well, you want to be aggressive with it? Because I'm going out of town tomorrow, and this was 2 weeks ago. And I said, so I'm fixing to be gone. You want to be aggressive? He said, yeah. I said, let's do it at least 4 days a week for 2 weeks, and let's see what happens. He did on that Thursday, Monday, Tuesday, Wednesday, Thursday, Friday, Monday, Wednesday, Tuesday, Thursday. The next week, Monday, Tuesday, Wednesday, Thursday. He called me the following Monday and said, I won't be in at all this week. I'm not wearing Depends at all anymore. I've got a home program. Let me roll with this for a while. I think I got it. So, it was that radical. From peeing all the time, having zero awareness of when he was peeing, so his sensation was poor, but he just had surgery, so a lot of things are, changed when you've had surgery. He had poor sensation, he had no idea, he just knew that when he did go in the bathroom and look down, which he never made it to the bathroom, so he was also having urge issues, he would have an urge, but he couldn't make it. And then he was having stress issues, anytime he tried to get in his truck, anytime really. And then there were those times that he leaked and he would go to the bathroom, he'd look and he'd be full and he'd be saturated and he had no idea when he went. He couldn't really feel it very well. So he was a pretty major case and was over it in 2 weeks. But I love that he came so early. He's the one whose doctor down south said, you need to go to this therapist in Manville. He got on the phone, he tried to find somebody who could do it here. And he sought help quickly after his surgery. Another guy that I started with this week has been suffering with this for 3 years. After his surgery, he's had incontinence for 3 years. His will be harder to fix, but I do have a study that we found where they took, how many men? 208 men with prostatectomy related incontinence, who've had it from 1 to 17 years incontinence, with the mean being 5 years. And I think it was like 90% or something had improvement. The greatest improvement was seen in the first 3 to 4 weeks. So maybe that's why my guy did so great. Now he's not wearing Depends. I did talk to him yesterday, and he's got some little protective pad in, just because. And I'm like, that's a good idea. There's other things that men can do too. There's clamps that they can use. Well, there's surgical means, but if we can do it more conservatively, that's certainly, I think, better. Anyway, so this kind of proves that even if you've had it for a while, we can help you. You just may be with us a little longer.
With prostatectomies, a lot of people have pluggage, scar tissue where the urethra is put back into the bladder.
Mm-hmm.
It's a scar tissue on there, and that has to be removed surgically or this.
How long post does that usually happen?
I went through it 3 times.
Lord have
And it
mercy.
was within 2-3 months.
Really?
That depends.
Huh?
That depends, that can happen really
Is that
anytime.
usually from radiation or just, is that usually from, did you have radiation?
Surgery.
Yeah, sorry, I have radiation.
Oh, okay.
In fact, I was called down in Baton Rouge, I plugged up.
Mm.
Talked to my urologist up here.
And there's no,
Well, get here as soon as you can, and I did, and he tried to tear that stuff, that scar tissue. Ultimately, I went in and had
That was pleasant.
surgery. Removed the scar tissue.
yeah.
Not very pleasant.
I said, I bet that was pleasant. He said, no.
No.
Okay, y'all have any questions?
Oh, you've been very informative.
Oh, good.
I wasn't aware of all that.
Where have you been the past 2 years?
I've been here. I've been here. I'm telling you, I don't know what else I need to do to get the word out.
Well, as we get older, you start thinking about that, and as you say, in nursing homes, people have problems, and I wasn't aware there was a solution to that kind of.
Yeah, I've got an older lady who came,
I've been out there before, but for other things, they do good work. out
Thank
there.
you. Well, about 2 years ago, I had an older lady, she's probably 70, I don't know, maybe mid-70s. and she was losing her urine, and we worked with her, she got better. But her main goal, she's back, and I love her for being proactive like that. She's like, I don't want to just then tell me, well, that happens, you know, when you get older, that just happens. I love that about her, you know, she's very active, she goes to the wellness center every day, she wants to do the road, she has got a lot to do. And she's having to take medicine to help dry her up, and she said, I don't want to be on all this medicine. So, let's go again. And so we're going again, and I really do think she'll do fine. We sent her home today with this electric stim unit. I said, here's how you use it. You turn it up till it starts to contract. When you feel it contracting, and it starts to hurt a little bit, back it back. Stay there. And every time, and then we have it 10 seconds on, 5 seconds off. Backwards. 5 seconds off. Every time it comes on for 5 seconds, it's gonna squeeze, you squeeze with it, learn your Kegel again, learn those muscles, because you've just had atrophy. I've got, you know, I was talking to my neighbor the other day, she's had 6 kids. And I just happened to mention that I was gonna come talk, and she's like, you do that? And I was like, yeah. She's like, God, I'm peeing all the time. I mean, it's very common. It's very common.
What's your women?
But people just